Wendell Potter is a guy who we've talked about on the show before. He is the former VP of a major health insurance company, and he's now dedicated his life to blowing the whistle on how evil the system is and pushing for Medicare for all, because he saw it firsthand what it's like when you have the profit motive in these health insurance companies, when you have this unnecessary parasite mafia middleman getting in between people and their doctors. He saw the impact of that firsthand, and he's like, wow, I can't have anything to do with this because this is just wrong. So I'm actually shocked that MSNBC let him on air here, but they let him on, and he's going to discuss surprise COVID-19 billing.
Bill, you hit on something that we've taken on as a pet issue here on this show, and that is surprise medical billing, going into a hospital and not realizing that even though your hospital is in network, the doctor treating you or the doctor giving you anesthesia or some other treatment might not be in your network. You touched on it there. Can you expand that further and tell me the likelihood of walking into a hospital to get treated for COVID, a hospital that you think you're covered by, and not walking out with a doctor's treatment that was covered by your insurance?
Well, your chances of that happening to you are increasing, again, because United Healthcare and some other big insurance companies are culling their networks. They're getting rid of doctors and making their networks all that more narrow. And that includes, again, hospital-based physicians, ER doctors in particular, but also radiologists and anesthesiologists. And it's been going on for quite a long time, but it's been accelerating as we have been getting into this pandemic. So you can go to the hospital, and it may be in your network. And even the doctor, when you signed up for this health plan, was in network. But because of the actions that United and others are taking, they're terminating these contracts at the end of the year and as on an ongoing basis. So you could wind up paying a lot of money because the doctor treating you is out of network, and that doctor in many cases has no alternative but to bill you separately because the doctor is no longer in the insurance company's network.
One of the other things that Wendell Potter has done is he detailed that while these health insurance companies are going to cry poverty during this crisis, they're actually one of the few industries that's getting away scot-free, and they're going to do even better. And they're going to jack up premiums, in some cases 40%, and they're going to skim on the COVID treatment. So they're absolutely positively going to be fine. And in the process of protecting profits for their shareholders, they're going to screw over regular people who need the treatment, who need the care. This is something he's been blowing the whistle on for a while now. And we should all be eternally grateful and thankful that somebody who was in the belly of the beast is now saying, no, you guys are right. You know, everything that you're pushing for is correct. And the business model is unscrupulous and evil, and we need to change it. So let's take this a step further here. The anti-corruption news site Sludge says the following: Democrats' health insurer bailout follows bundled checks from the industry's lobbyists. Health insurance lobbyists have collected nearly $250,000 for the DCCC so far this cycle. The Democrats' proposal mirrors a recommendation put forward recently by the health insurance industry. Less than a week before the Democrats floated their plan, the presidents and CEOs of Blue Cross, Blue Shield, and America's Insurance Plans, AHIP, the health insurance industry's top lobbying group, sent a list of policy proposals to Congress, including a recommendation that it provide full federal subsidization of COBRA premiums, while House Democrats are generally more open to expanding government health programs than the Republicans. The Democrats' campaign arm has deep financial ties to the for-profit health insurance lobby. So far in the 2019-2020 election cycle, lobbyists who represent the health insurance industry have raised more than $736,000 for the Democratic Congressional Campaign Committee, the campaign arm of House Democrats that works to protect incumbents against Republicans. So if you were wondering why it is that 80% of Democratic voters want Medicare for all, and there's only a handful of Democratic politicians actually fighting for it, this is why right here. And this is why I get frustrated, is because people in mainstream media will act like, no, what do you mean? We're having an honest ideological disagreement. We're having an honest debate. What do you mean? That's what it is. You know, Joe Biden is in favor of expanding the Affordable Care Act, Obamacare, and Bernie's in favor of Medicare for all. It's an honest discussion. It's an honest dialogue. Those are two legitimate positions, and they're just hashing it out. No, because I submit to you, even these corporate Democrats, they know deep down, well, yeah, single-payer Medicare for all makes sense. A national healthcare system makes sense. Duh, every other developed country does it. I know that they know that deep down. But the reason why they will not fight for it, they will not argue for it, is because they are bought by the industry. And they are taking their marching orders from the people who they should be fighting. You should be fighting these health insurance executives because their wishes fly directly in the face of what's good for the American people, your constituents. So there's not an honest ideological debate and discussion happening in the country. One side wants the solution. The other side is fighting to exacerbate the problem. That's what's happening. And this is why. Because they're taking tremendous amounts of money from the industry, whether it's Big Pharma or the health insurance companies or Wall Street or the military industrial complex. All of the people, all these terrible, corrupt, backwards industries, they have bought not just the Republican Party, and they have bought the Republican Party, but they've also bought the Democratic Party. And so this is why you see, you know, a lot of people are looking at me like, I don't get, why would you not vote for Biden? He's a lesser evil than Trump. Because this is what I see when I see Joe Biden. I see this story. I see, honestly, a guy who's corrupt beyond imagination. I see a guy who has no core, he has no values, he has no true, policy beliefs. He's just going along to get along, and he looks at this and goes, duh, like this is obvious, it's just how the system works. We take the money from the health insurance companies and we do their bidding. Well, look at the result. Now the Democrats, in the middle of a pandemic, are arguing not for expanding Medicare, not for expanding Medicaid. Their argument is, quick, let's let the health insurance companies loot the treasury. Let's do endless subsidies to the unnecessary mafia middleman. Shower the mafia with money, and then let them turn around and continue to rip people off. That's the Democrat solution. Why? Because they were paid to push that solution. They're paid for it. And this isn't a solution at all, just so you know. The real goal of this is to, just like in the same way that all these so-called bailouts really was just corporate socialism to let the corporations and the financial industry loot the treasury. That's exactly what this is with the health insurance industry. Just let them loot the treasury and then, hope they do the right thing. Sit back and hope that they take care of enough people where people don't revolt. That's the approach. That's the mindset. And it's disgusting and it's insufferable and I can't stand it. We don't even have a Democratic Party in a pandemic that's pushing for universal health care. It's a pandemic and they're still not pushing for universal health care. FDR is rolling over in his grave right now. JFK is rolling over in his grave right now. I mean, these Democrats are a shadow of previous generations. And that's not to say the previous generations didn't have problems. They did. But you're kidding yourself if you don't think we've shifted further and further and further right. We have. We're so far right that the Democratic Party, they're a conservative party now. The Democratic Party is a corporate conservative party that backs industry at all costs. And the Republican Party is off the spectrum on the right. That's what we have now. So this story should really wake you up and should really show you why it is. And if you don't understand, hey, I don't get it, lesser evil voting, I don't get why more people don't want to do it. Maybe this will help you understand why. Because I don't view Joe Biden as he's a good guy who disagrees with me on some stuff. That's not how I view him. I view him as just an irreconcilably corrupt tool of industry who deep down knows what he should do and what he should fight for, but he's not going to do any of that because he's busy playing the game. And the game includes always serving industry over people. To the point where, to such a comical degree now, where they won't even push for universal health care during a pandemic. They'd rather fight for subsidizing the industry so that the executives can continue to get rich and the shareholders can continue to get rich as people get skimped on their care. So it's unacceptable and it's terrible. And I hope this is a wake-up call to many people that what we're dealing with here is not an honest disagreement in the system. We're dealing with a system that is so corrupt that it's laughable.